Hey, I'm Mark Wooten. I was going to talk today about sleep apnea. I am currently a sleep center supervisor at Blue Ridge Pulmonary and Sleep Medicine in Morganton, North Carolina. I was wanting to talk about what is sleep apnea, the health risk associated with sleep apnea, and the available treatment options. So basically, if you've ever felt like you're exhausted after a full night's sleep, or you've been told you snore, or you've ever woke up gasping in the middle of the night, you could have sleep apnea. I firsthand saw many patients that have sleep apnea, and it disturbs their lifestyle pretty much, and even disturbs their family's lifestyle also. Many people are unaware of sleep apnea, that they even have sleep apnea. In this terms, it poses some dangers in your health. Today I want to talk about what it is, the health concerns, and the treatable options available. Sleep apnea is a sleep disorder that causes respiratory issues while you're sleeping, which basically you'll start to go to sleep and you will have a respiratory issue, and it'll slightly wake you up within the middle of the night, which we call an arousal. You won't even notice half the time that you've been awake, but this over and over throughout the night causes a lot of problems, which makes you feel so tired when you wake up because you really never got into a deep sleep or REM sleep. There are three main types of sleep apnea. One would be obstructive sleep apnea. Obstructive sleep apnea is a cessation of airflow for at least 10 seconds in duration, and it's basically a soft muscle tissue in your throat that's pretty much closing your airway as you go to sleep. As that muscle relaxes in the back of your throat, it pretty much closes the airway, or slightly closes the airway, which restricts your breathing. Central sleep apnea is when your brain fails to send a signal for your body to breathe due to CO2 gas exchange. CO2 is what the body needs to expel, and that's really why you start breathing. It's not so you can take in oxygen as much as you can get rid of CO2. There's also complex sleep apneas, which are combined of central sleep apnea and obstructive sleep apnea. And these complex cases can be seen in people with COPD, emphysema, or any kind of restrictive lung disease. Symptoms usually include snoring, choking, gasping, excessive daytime sleepiness, or hypersomnia is a huge symptom. Sometimes you will wake up with headaches, tend to wake up with headaches because of oxygen dropping in the middle of the night. You could be irritable, and you could have trouble concentrating throughout the day. All these are huge symptoms of sleep apnea. Sleep apnea has been linked to some serious health risks: cardiovascular problems, high blood pressure, stroke, heart disease. The metabolic and cognitive issues sleep apnea can worsen insulin resistance and type 2 diabetes. It can also cause memory loss, function, focus, poor sleep quality, concentration that I mentioned earlier. Long-term patients with apnea for the long term have a lower life expectancy than most. Fortunately, there's a few treatments that are available out there that really work well. The first one that your doctor will always tell you is you need to lose weight. Don't drink alcohol, and positional sleeping is a way. If you have a mild sleep apnea, you can start sleeping on your side, and it should alleviate some of the issues. The best way to alleviate these issues would be through a CPAP machine, which is an acronym that stands for Continuous Positive Airway Pressure. This will open up the airway that's been obstructed by this soft muscle tissue and make it able for you to breathe throughout the night, and should get a very sound sleep. These CPAP machines there's a learning curve with them. Sometimes people can't tolerate it very well, so therefore they have other ideas like oral appliances and even surgical issues such as Inspire. Inspire is where they take a motor nerve from your tongue and put a stimulus to it with some sort of low voltage, which would move the tongue out of the way in order to open your airway up while you're trying to sleep. So in conclusion, sleep apnea can have many different symptoms. It can cause a lot of healthcare or health risks in your life, and there are answers. So if you feel like you have sleep apnea, go see a sleep medicine doctor. Thank you.